to Calm Before the Storm, a podcast on planning for, preventing, and responding to medical emergencies. Brought to you by the San Francisco Emergency Medical Services Agency.
Hello, I'm Dr. Mikaela Middleton, an emergency medicine physician who specializes in EMS and disaster medicine. In addition to being an EMS physician, I am a woman of transgender experience. I'd like to talk to you about caring for our transgender and gender-diverse patients, also known as TGD. San Francisco is one of the largest sanctuary cities for TGD patients in the United States, so it is crucial that EMS clinicians are equipped to care for them.
Thank you so much for joining us today, Dr. Middleton. My name is Erin Backus, Information and Education Specialist here at the San Francisco Emergency Medical Services Agency, also known as EMSA. Thanks to all the listeners out there for listening in to learn more about this important topic. Let's get to it. Some people may ask, is misgendering harmful?
Yes, it is. You may have heard the old adage, sticks and stones may break my bones, but names will never hurt me. The problem with this adage is that it is not true about the hurt caused by words. I want you to think back to a time when you felt mistreated and think about the care you received or the situations that occurred. Though there may have been physically painful experiences, you're more likely to remember how you felt when somebody said something during that time than the pain itself. In addition to misgendering people of transgender and gender-diverse experience, TGD people face discrimination in other ways. It's important for EMS clinicians to recognize these issues as they can affect care and healthcare outcomes. Beyond purposeful misgendering, TGD people may experience people refusing to call them by the name they go by. They may feel that they are a spectacle where people may voyeuristically view them, and like the larger LGBTQIA+ community, they may be misunderstood by the relationships they have with others, such as having a chosen family versus blood family structure. It is important to know that California has protective laws for TGD people that include gender identity and sexual orientation. TGD patients have rights to gender-affirming care, including EMS care. As employees, they have rights that protect them from discrimination in the workplace. To give you an idea of the number of TGD patients who feel discrimination, a study found that 25% of TGD patients avoided healthcare because they feared they would be mistreated. Mistreatment includes misgendering. Another study found that things TGD patients worried about when they sought health care included being misgendered or called by a name they do not go by, not getting the care they were seeking, and not having privacy maintained during their visit. I want to make it clear that not all misgendering is on purpose, so it is important to avoid it from occurring in the first place. This will improve patient satisfaction and be more affirming. In addition, you may feel more comfortable taking care of TGD patients as a result. We will talk more about these strategies in a few minutes.
What are some common mistakes clinicians make?
Misunderstanding transition. There are many ways to transition. Medical transition is using hormones and blockers that may affect mood and produce desirable physical features. Surgical transition includes surgical procedures that may change appearance and function. These are things that most people are familiar with, but the most common is social transition, where wearing affirming clothing, sometimes using prosthetics, using pronouns, and using a name that is affirming is the most common. Legally changing one's name and/or gender. This is not required, and to be clear, not using the name and pronouns a patient uses is poor practice and could be considered discrimination as mentioned before.
Wow. Thinking about TGD patients, it seems like using the name and pronouns a person goes by doesn't just extend to TGD patients. Many people use nicknames or other names rather than their given names all the time.
That's correct. A lot of the things we're talking about today are things that affect all patients, and the strategies we're using can be applied to all of your patients. Another issue is that clinicians can become distracted by someone's gender identity and making the visit based more on the fact that they are transgender than the chief concern itself. There is a term for this. It's called trans broken arm syndrome.
Why is it called that?
Because if you think about breaking your arm, does it matter if you're male or female and how the chief concern is fixed?
Definitely not.
Right. It doesn't matter. It's usually a moot point in a patient's care. It's like making a big deal out of having a left-handed hammer to pound nails into wood. It doesn't matter. So, talking or charting about a patient being transgender or TGD is not always relevant. I think the easiest way to think about setting yourself up for success in taking great care of TGD patients is to run through how a patient encounter should go. This is not all-encompassing, and we will have online continuing education available to delve into these topics more. In the patient encounter, just like with every patient encounter, you should first introduce yourself to your patient with your name and pronouns. Then offer the patient to share how they would like to be called or addressed. Next, identify the relationship with people with whom the patient is around to ensure privacy.
How could this be different for TGD and LGBTQIA+ people?
TGD and LGBTQIA+ people may not be out to everybody they're with, and it's important to maintain privacy if necessary. The next consideration is interviewing patients. Ask the patient questions in a respectful way regarding their gender identity and privacy. As mentioned, don't out the patient.
If I may interject, can you explain what outing is?
Outing occurs when somebody's gender or sexual identity is made known. This is a private issue for the patient, and it is important that we keep it private. The next interview consideration is to care for TGD patients won't really differ from most patients. It's important that the clinician target their interview that addresses the chief concern and focus on that. It's important to use trauma-informed care in this approach. There are some chief concerns, however, that require some understanding of surgeries and medications a TGD patient is using.
What are some of those chief concerns where more TGD-specific info is needed?
Chief concerns such as abdominal pain, chest pain, and shortness of breath.
If any of those chief concerns occur, what should the next step be?
You should ask what organs a patient has or doesn't have, or transitional practices that may be related to the area that the chief concern encompasses. For example, if a transgender man has abdominal pain, I would ask about surgeries they have had before, such as a hysterectomy or oophorectomy, bottom surgery to include a metoidioplasty or phalloplasty, etc., pregnancy status, and medications they're on. For the examination considerations that should be made, it's important to be affirming and to focus on exams that only relate to the chief concern. Trauma-informed care should be followed.
What kind of exams might be different with a TGD patient?
I'm glad you asked. Most won't be. However, if, say, a transgender man has chest pain and is chest binding, it would be difficult to do a 12 lead around it. In this case, the clinician should inform the patient of the reason for the exam, then explain the exam in an understandable manner, and then ask permission to perform the exam, like you do for any exam. Here, because binders are very unique to each patient, the clinician should elicit the help of the patient and work together to accomplish the exam in an affirming way.
You mentioned trauma-informed care a few times. What is it?
Basically, trauma-informed care is an approach where the clinician recognizes that the job we do can sometimes make a person's own trauma worse. Sometimes we have to do painful procedures, ask difficult or embarrassing questions, and be present in times where tensions are high or a patient has been assaulted. Basic principles that you can incorporate into your care include 1. Give the patient control over consent to an exam or questioning, allowing them to say no. 2. Engage in shared decision-making of examination options. These include positioning and chaperones. 3. Explain the procedure with narration of each step using preferred terminology. 4. Inform the patient of modifications available for the procedure, such as positioning options. 5. Acknowledge and validate a history of trauma or previous negative experiences when they become known to the clinician. When you close the encounter, thank the patient for sharing information. Securely only share TGD status of the patient with need-to-know people in the patient's care, and only share necessary information. When you are documenting the encounter in your PCR, only write details necessary in the care of the chief concern of the patient. Refer to the patient by the name and pronouns the patient uses. If a patient's TGD status is not necessary to know in their care, it is important that it is not emphasized in the chart, just like mentioned earlier, to avoid the trans broken arm syndrome.
Wow, there seems to be a lot of nuance to taking care of TGD patients.
Yes, there's a lot of information to understand TGD people to provide better care. However, it can be easier to care for TGD people if you boil it down into a few things. 1. Use the name and pronouns a patient uses. 2. Focus on the chief concern when you are interviewing, examining, and writing up a PCR of the patient encounter. 3. Try to incorporate trauma-informed care into your approach of all patients. This will make difficult situations go a lot smoother and help prevent causing more harm to patients.
I really appreciate that summary, Dr. Middleton. Thanks for taking the time to join us today and share your experience and expertise. We appreciate you.
Thank you, Erin, and the EMSA in general. And thank you to all of the EMS clinicians for your dedication to taking great care of all San Franciscans.